Hey CAM followers, welcome to another one of our lives. Tonight we are joined by the wonderful Dr. Kit Sturgess, who is I'm going to quiz on the RCVS, a bit about BSAVA and some internal medicine bits and pieces, which I'm really excited about. I'm going to pass straight over to Kit just to explain a bit about who you are and how you got into doing all the amazing things you do.
I've been very lucky in my veterinary career. I've kind of fallen into things rather than it being by deep design. So I spent 6 years in general practice, and initially it was very general mixed practice: cattle, sheep, horses, pigs, small animals, and then gradually became more interested in small animal medicine and went back to Bristol, and then lectured at the universities for a while. Then went into private referral practice. I set up my own referral practice, which is now Anderson Moores. And now I have something of a, I suppose, what would be described now as a portfolio career. So 50 or 60% time in clinics and the rest of the time doing governance for the Royal College, but also cats protection, a local sanctuary which rescues tigers, governorship of schools, just a whole range of things. And it really taught me one thing about vets, isn't it? And veterinary professionals, that we actually have huge amounts of talents that we just don't recognize, like dealing with people. Often we deal with very distressed, emotional, sometimes quite angry people, and we just take that as part of our daily work, but actually it's a real skill in communication that we've learned.
Yeah, absolutely. So you touched on the RCVS there, and that's something that we mention quite a lot as vets. But I think quite a lot of owners don't really know who the Royal College are and what they do. So do you mind explaining a bit about that?
Sure. So the Royal College is the regulator of the profession, but it's unusual in that it's a Royal College and a regulator. So most other medical professions have separated their regulatory function from their Royal College function. So, for example, in medicine, you have the General Medical Council, which is the regulator, and then you have a variety of Royal Colleges like physicians and similar. But because we're quite a small profession, we've kept the two parts together, and that has some challenges because we have to make sure those two functions are separate, but it has some real advantages. So that if, for example, as the regulator, we see that there is a problem that comes frequently through the regulatory process, then we can look to change the way that we manage, vets manage cases, give advice about how this should be done to try and prevent people coming before the regulator. So the real drive in terms of regulation at the moment is what's called Upstream Regulations. So the idea is that the veterinary profession, both the vets and the nurses, are better equipped and do things in the appropriate way so they never end up in front of the regulator, which has got to be good for animal health and welfare. Yeah. And the Royal College side is very much into animal health and welfare, ensuring that the public's protected, ensuring that we do our very best for the health and welfare for all the animals that are under veterinary care, whether that be cats or dogs or fish or budgies or horses or tigers or anything else, and work hard to try and make sure that the profession is vibrant, learning, mentally well, which is always a challenge in the medical professions. So that's so the college has many functions and does many things. Also sits as a bit of a coordinator of activities, so bringing various groups together to talk to each other about the problems they may face or solutions that they have. And also we have a mediation with government. So there's the Department of DEFRA. I lose the acronym there. Environment, Food and Rural Affairs, and the college talks to them. We are involved in Brexit because of the way that food that needs now to be exported out of the UK will need health certification. Food that's coming into the UK will need to be inspected. So the veterinary profession is an essential part of that food chain to ensure it's safe to eat, ensure animal welfare. And also the college regulates the veterinary nursing profession. So when I first qualified, there were veterinary nurses, but relatively few of them. Now there are, I think, approaching 18,000 qualified veterinary nurses who have their own professional identity, their own professional role, doing things that vets don't do. I think when I again, first qualified nurses were often seen as people who would have been vets but didn't get into university, whereas now I think they have a heap of skills that I just don't have and interests that I don't have, and they provide a huge amount of additional support to the animal population, and have their own clinics. They're allowed to do a certain number of techniques, and so they're a real asset to the care of animals.
Yeah, they totally are. I couldn't live without my vet nurses. So
absolutely,
they're all magical. I always call them my magical nurse fairies, because they just do things and the animals get better, and it's amazing. They are incredible, and like you say, a massive asset to the team.
And I think a lot of owners do feel a bit more comfortable talking to the veterinary nurse sometimes than the vet. Maybe the veterinary nurses have a bit more time, or they're just a bit more empathetic than vets who perhaps are sometimes a bit too medical or a bit too surgical, and owners feel a bit more comfortable. So that's another really important thing, that everybody understands the problems that their pet may have and how it's being managed.
Yeah, they are brilliant communicators, definitely. So just to summarise what you were saying about the RCVS, in terms of who they are to an owner, they are there to protect the rights of animals in general, and that's the sort of so that's where you'd go if you wanted to make a complaint, if you felt your pet wasn't happy or something had happened that you felt was really terrible. That's where you would go.
So the Royal College is there to protect animal welfare and protect the public, to make sure that the veterinary care that their animal receives is of the best quality.
Yeah.
And there are two arms to the, if you have a problem. So the Royal College deals with serious professional misconduct. So that wouldn't be that perhaps you felt the fee was too high, or that there had been some communication issue. That usually wouldn't come under the auspices of the Royal College. It'd have to be something pretty serious.
Yeah.
But if you ever have doubt, then phone the professional conduct department at the college, talk it through with them, and they will be able to advise. But we also have an alternative disputes resolution service run by a group of solicitors called Knockholds, and they are much more targeted towards that sort of communication, where there's been a bit of communication breakdown or some disagreement about how a fee was charged, and they're a mediation service, so they don't have regulatory function, but they deal with things that really wouldn't come under the umbrella of what the college does. So if you have something like that, then you can look up Knockhold solicitors or the veterinary client mediation service on the internet, and that will give you their number. It's a free service. It's paid for by the college, and it means every animal owner has the access to a mediator should they need one.
Yeah.
What I would say is that the veterinary client mediation service, Knockholds, will not deal with the case unless it's already been through the practice resolution system. So it's not for the first call when you are upset about something. It's for when you've exhausted the practice's processes and you don't feel that the outcome has been what you were expecting.
Yes.
And a lot of what Knockholds do is actually help people just understand what it is that they want, because sometimes we just get really angry about things, which is quite normal, but we don't really know what we expect the solution to be. And so sometimes it helps to know what your solution is, because then you can perhaps go back to your practice and say, well, this is how I want this. I would like this to be resolved. Yeah. And they're much more likely then to be able to help with that, because they know actually what you are trying to achieve.
Yeah, I think, you know, I have to say that in general, Cam likes to recommend going and speaking to your vets in person and trying to keep things nice and calm and just talk things through, because at the end of the day, we're all human beings. Vets make mistakes. Sometimes it is just time and communication, and maybe we've thought we've said something and we haven't said it, or we've just not explained thoroughly enough you know, what's going on with your pet. So I think most things can be resolved with just a sit down and a proper talk through.
I entirely agree. I think that is absolutely the first way to go, but just have a thought about what it is that you want to know or want to talk about, and then I think that will be much more likely to result in a positive outcome for everyone. And vets and vet nurses and all the care assistants and the receptionists are not there to do a bad job. They're there to do the very best job they do. But there are literally hundreds of thousands, probably millions of consultations every day for animals. And out of those, there's bound to be some that just don't go according to plan. The profession is very lucky in that surveys suggest that overall owners are very happy with the general service that the veterinary profession delivers for them, happier than, to be honest, the medical services or dental services they receive. But that doesn't mean to say we shouldn't keep striving to do better, make sure we're communicating properly.
Yeah, absolutely. I think that's it, isn't it? Communication is the key to everything. If we can communicate better between us, and I think, Cam, we're so passionate about trying to build really good vet and owner relationships, which is why we wanted you to come on and just explain a bit about the RCVS, because it's important to know where to go and who to talk to when things aren't going the way you hoped for.
And the one thing I would say is if a vet or a vet nurse or a receptionist or anybody says something that you just don't really understand, then say so, rather than nodding because you think, oh, I should understand that. Just say, that doesn't make sense to me, or I don't understand that. And the person will then be able to explain it to you. Maybe they've explained it badly, or maybe you haven't heard quite what they said, or that they just haven't really explained it in a clear fashion. But it's much better then to sort it out there and then when everyone's in front, when your pet's in front of the vet, and you can go through it with them. Yeah,
absolutely. Lynn, who's just listening in to us today, has just said she always writes down a list of things to ask her vet about, and the vets always appreciate this. So I think that's true. It's just making sure that you have gone to the vets with a clear idea of what you're worried about, and then you ask all the questions you need to. And if you come away and you get confused and you've forgotten everything, because often it's very highly stressful because your pet's not well and you're worried, then give them a ring, because most vets will be really, really happy to go through it again. Don't get yourself into a horrible situation where the vet thinks that you know what's going on and actually you don't. And it's very easy to get into because you feel, like you said, that you're scared to actually ask those questions because you feel stupid. Because I mean, we often say things in funny vet terms that we forget that other human beings don't understand what we're talking about, because that's what the words we use between ourselves. So it's easy to get easily confused.
And vets feel the same way. Whenever I talk to the person who looks after my computer, I get equally confused very quickly, because it's just not my area of understanding. And so it's just important to remember that everyone has their language, which is part of what they do. I noticed there's also a question from Lynn about concerns about the availability of veterinary medicines as a consequence of Brexit. There is a lot of work going on behind the scenes, even during this COVID crisis, to try and make sure that supplies are maintained and that we don't have shortages. So I think by and large, there shouldn't be a major problem. There are always intermittent supply issues with drugs, and that's usually down to specific manufacturing problems. So occasionally vaccines, for example, will become unavailable because there's a problem with the manufacturing plant. There are always a number of medicines that are unavailable, and it's not usually anything to do with importing them. It's more to do with the factory that's producing them. And one of the issues with veterinary medicines is that the amount that they produce is small compared with human medicine. So there's usually, for many medicine, there's only one factory in Europe that produces it, or in the UK. And if that factory has a problem, then that's it, that stock becomes unavailable. So I think recently there's been a problem with meloxicam, for example, metacam, and these things will come and go, but it's not an expression of issues with Brexit.
That's good to know. Do you know,
Esme, you've gone quiet?
Oh, hello, can you hear me? Can you hear me? Hello? Am I here? Can you hear me? Hello, can you hear me?
Hello?
Can you hear me?
Still no sound.
Hold on.
So, Lynn, certainly I don't think there's going to be a problem with non-steroidals for arthritic dogs. There may be specific ones which occasionally get difficult to get, but I think there are a wide range of options available. Could mean that you might have to change an arthritic drug from one arthritic dog from one drug to another, at least in the short term.
Hello, am I back now? Can you hear me? Still can't hear me. Oh.
Sorry, we seem to be having a few sound issues.
Why? Can you hear me now? Any sound? Okay.
Technology is a wonderful thing until it decides not to work on you. Okay, it's just me then.
Can you hear me now? Okay. Right. How do I ask you questions?
Can you try again, Esme? Just
hello. Can you hear me?
Do you want me to log off and try and log back on again and see if
yes.
I can?
What we'll do, guys, is we'll end the whole call and then we'll come back on again.
Okay.
Sorry about that.
So Esme and I are having to communicate by text and sign language now. I think there are a lot of potential worries about non-steroidal anti-inflammatory drugs. My experience always of drugs is that drugs that are effective also have side effects. So if a drug has no side effects, then often it's not effective at all, because in order for it to do something to the body, which we want as a positive benefit, there are also potential negative effects that these drugs may have. And we also prescribe very large numbers of non-steroidals because they are very effective drugs. So we do see quite rare side effects occur from time to time. So the main thing really is to make sure that when you use these drugs, you're using them in an appropriate way, at an appropriate dose. If you have any concerns about how they might interact with other conditions, then you should just make sure your vet who's dealing with you is aware that perhaps there's been something in your pet's past that might impact on the way that non-steroidals might work. The other thing we have to take into account is that it can be difficult to manage animals and pets with multiple diseases, and we have to look at the quality of their life. So, for example, we know that there are potential risks with non-steroidals and, for example, dogs with heart disease. Certainly in people, there are a few people for whom non-steroidals can precipitate heart failure with pre-existing heart disease, and we have to be aware of that. But if your dog has crippling arthritis, that's really impacting quality of life. And I know that CAN will have a number of solutions which are not non-steroidal anti-inflammatory drugs, but we have to accept that non-steroidal anti-inflammatory drugs are really great drugs for managing or being part of the multimodal plan for managing osteoarthritis. So sometimes we have to balance the risks and the benefits. In terms of kidney disease, I think people are very concerned about the use of non-steroidal anti-inflammatory drugs in kidney disease. And there's no direct evidence in dogs about safety, but there have been studies done in cats, probably because we see more kidney disease in cats than dogs. And those have not shown the groups of cats that are on non-steroidals with kidney disease, their kidney disease progresses faster than the kidney disease of cats not on non-steroidals. So the key issue is, and the key problem with non-steroidal anti-inflammatory drugs, is it affects the kidney's ability to function. And when life is normal, it doesn't matter because the kidney doesn't need those special functions. But if your pet becomes dehydrated, for example, because it's been sick or has diarrhea, or then the kidney has special mechanisms to protect itself, and non-steroidals prevent those mechanisms from working effectively. So where non-steroidals do become a particular issue is if your pet isn't well. So what I tend to talk to owners about where I have dogs with kidney disease that also are on non-steroidals is you just have to be more alert to getting help sooner. So for example, if I have a young dog that's vomiting, If it vomits for 24 hours and gets a little bit dehydrated, then that's not really a big issue. And many of them will have eaten something they shouldn't, and 24 hours later they'll be back up and wagging tail and off they go. But if it was a dog with kidney disease, then I would be much more inclined to have that dog into the surgery, get it on fluids, make sure its kidneys are being well perfused, and therefore protecting its kidneys from the potential harmful effects of non-steroidals. Similarly, people are worried about the liver and liver disease and non-steroidals. Most of our non-steroidals have fairly low impact on the liver. It's probably the older non-steroidals like phenylbutazone that were particularly nasty, and we don't use those anymore, mainly because they do have issues. So again, what we tend to do with dogs with known liver disease that need non-steroidals is to work at keeping the dose of non-steroidals that we give to the lowest that's effective, and probably work a little bit harder at dropping the dose till we find the right amount than we perhaps would with the dog that doesn't have liver disease. The other area of concern would be in the gut. I'm sure all of you, when you get given your non-steroidals, have a little bit on the label which says if your dog develops diarrhea or vomiting, you should stop the non-steroidal. And that's really driven by the risk of ulceration of the stomach. And we know that non-steroidals prevent the buffering, so the neutralization of acid in the stomach. And without that neutralizing ability, the stomach is a bit more vulnerable. So in your stomach, or in the dog's stomach, the pH, the acidity is really quite low. So it's a pH of 1 or 2, which is really acidic stuff, and that will burn. And there are various mechanisms like producing a mucus layer and producing an alkali called bicarbonate that stop that from being a problem. And one of the issues with non-steroidals is that bicarbonate production is reduced, and to some extent mucus production is reduced. So dogs are a little bit more vulnerable under those circumstances. We know too that certain combinations of drugs are worse. So for example, if we combine non-steroidals with steroids, drugs called like prednisolone, then that really is a very ulcerogenic risk. So we just need to be aware of those problems and manage them accordingly, and try and get the best quality of life that we can for the patients under our care. Do you want me to answer? Okay. So the question for Esme was how cardiac disease can affect a dog with osteoarthritis and cachexia. So, I mean, certainly cardiac disease, cardiac cachexia, which is a condition where dogs lose weight because of their heart disease, is actually really less common in dogs than it is in people. It's usually quite a late stage. Heart disease tends to be really advanced. But where heart disease probably does impact osteoarthritis is the fact that circulation can be reduced, particularly to the hind limbs. So sometimes one of the very early signs of heart disease in dogs, when I see them, is that owners will say, oh, it's not able to jump up into the back of the car anymore. And that's because it just can't develop enough power because it's not getting enough blood supply to the hind limbs. And if it's doing less exercise, then muscle mass will be lower, and we know that muscles are really important for supporting joints and mediating some of the negative effects of osteoarthritis. But just as in people, it is important to exercise dogs with heart disease. Obviously, they shouldn't be doing marathons and they shouldn't be doing greyhound races, but moderate exercise is important to keep them fit, to keep their muscle mass up, to keep their heart muscle fit too. So we don't wrap them up in cotton wool. That isn't the best thing for them. In terms of anaesthesia with heart disease, it depends a lot on what sort of heart disease they have, and it depends a lot on what degree of heart disease. But most of the early phases of heart disease, anaesthetic risk is actually although higher than a fit, young, healthy dog, is not really that high. So most cases we see are a disease of one of the valves called the mitral valve. And in those early stages, we really don't recognize a significant additional risk factor when it comes to anesthesia. What we do recommend, if possible, is to have that heart disease evaluated so that you know what level you're dealing with, so that can aid the person who's performing the anaesthetic to do it as safely as possible. And there are certain drugs that we tend to avoid in dogs with known heart disease. So some of our sedative drugs will drop blood pressure, and those probably aren't great drugs to use in dogs with known heart disease or known kidney disease for that matter. So we may modify our protocol to fit in with the way that the conditions that they have. In terms of, but I certainly wouldn't, if a dog with possible osteoarthritis needs investigation, such as x-rays, limb x-rays, then I certainly wouldn't say we shouldn't anaesthetize them because the risk is too high if they've got heart disease in the early phases. And it can be really important to understand more clearly exactly what the level of their arthritis is, what joints may be affected, and just check that it is arthritis, because not all lame dogs have arthritis. And although arthritis may be by far and away the most common cause of lameness, chronic lameness, it's not the only cause by any means. And sometimes we need to be sure that that's what we're dealing with.
Yeah.
There are quite a lot of questions coming in. Do you want me to try and answer some of them? Let's see. So there's one from Mira about Metacam and gabapentin. I would have to defer very much to Cam on this. My specialism is in internal medicine, so I deal with osteoarthritic cases because they are often old dogs have multiple problems, and so it's part of their management. But I would not be the person to come to talk to about specific management of osteoarthritis. So I'm going to leave that one, Mira, and pass that over to Cam for their advice. I would agree that with Melanie, that if we treat heart disease well and improve perfusion, then that will have some clear benefits in mobility. And again, we know with arthritis that if patients don't move, then their stiffness and discomfort can get worse. So that absolutely is the case. It's a matter of getting treatment in at the right time that's going to be most beneficial. I can't really say anything about CBD oil. I think, again, Esme and I were chatting just before I came on. I think you have had somebody talk about CBD oil, so they would be much more the people to talk to about that.
There is great lives on CBD.
Osteoarthritis and IBD, there's a question here from Penny. This starts getting into some really cutting edge conversations. So we're becoming to realize that the trillions of bacteria and other microorganisms that you have in your gut have many and wide effects on the body, and are involved in the inflammatory environment that can exist. So whilst we don't directly link inflammatory bowel disease with osteoarthritis, changes in those microorganisms in the gut may influence how animals respond, how dogs respond to treatment, how they experience their osteoarthritis. So one of the things I'm passionate about is the fact that animals are like people in that they all experience their pain differently and require different levels of control. So you cannot take an x-ray of a dog's hips, for example, and say, oh, well, that dog will be in pain and this dog won't. I've seen dogs with relatively mild changes that seem really painful, other dogs whose hips look absolutely dreadful, who, as far as we can tell, seem not to be that painful. So pain, like it is in people, is an individual thing and has to be treated on an individual way. One from Cam about how we might treat concurrent pancreatitis, management of osteoarthritis. That's an interesting question for which there isn't perhaps a really good answer. There are some concerns about the use of non-steroidal anti-inflammatory drugs in pancreatitis. There are a few case reports where it's been suggested that the use of non-steroidals has triggered pancreatitis, but they're certainly no case series. So the problem is, if you have a relatively common disease like osteoarthritis, sooner or later it's going to be associated with virtually every other disease. And that doesn't mean cause and effect. That just means the same disease is happening in the same patient, or two diseases are happening in the same patient. So currently, I think the jury is out. All I would say is I would be careful about using non-steroidal anti-inflammatories in a patient with active pancreatitis. But I think in a patient that's got a history of previous pancreatitis, it's not something that I specifically worry about. And perhaps as from an internal medicine point of view, then I might be trying to work out why the patient gets pancreatitis and try and prevent recurrence. But I'm not concerned about the use of non-steroidals. The question from Sue. So just saying that her little dogs really required X-rays in order to adequately treat the osteoarthritis. And in terms of complaint, then really, as we've been discussing, and as Esme said, I think your first port of call is go to your original vets and say, look, I just wasn't happy with how the management of my pet went, and I want just to understand more clearly why a particular test was done or wasn't done, and I think that really has to be the place to start, because I think that's important to have that conversation. And it may be that the practice hadn't realised that they haven't been offering the treatment that you wanted, and that they need to improve their communication, as Esme has said, that they perhaps hadn't offered clearly enough the options that were available to you to manage your particular pet's problems. I'm not sure if we have other questions.
So I'm just going to ask a question to Kit. Hopefully it'll come through on messages. I'm so sorry. Thanks for sticking with us, everybody. I want to, hopefully it'll come through. I just want to ask him what he sees as the future of owner education. So does he see other future?
That's an interesting question from Esme about how do I see the future of owner education going. I think it's a real issue. I think the problems we face is how you get hold of good information. There's masses and masses of information out there, but a real percentage of it is complete rubbish. And as an owner, it's very difficult to try and sift what is reliable, appropriate, considered information from somebody who has a bit of a hobby horse, and they're going to tell you that if your dog stands on its head for 10 minutes every day, it's going to fix its osteoarthritis. And that is a real problem. And I think what we need to do is look for to involve sites which have a known pedigree for balanced, appropriate advice, and look to that for information. But it is tough, and I think I find the same if I'm looking up at an area outside of veterinary medicine. There's loads of stuff on the internet, and just trying to find out what works, or what is appropriate, reliable information. But usually things like the Royal College, there's part of the Royal College called RCVS Knowledge, which has a lot of information on it, which is open access, which, for example, has a whole series of what's called knowledge summaries, where they'll take a topic and just bring together all the current literature, all the evidence, and try and come up with some balanced advice. So sources like that, some of the American universities, for example, have really good sites with good information. So it's looking for those sites which are which have that balanced approach, because I would pretty much guarantee for you that any problem you present in veterinary medicine, there'll be more than one potential solution. If you have a site that only offers you one solution to a particularly a broad problem, then that's unlikely to be balanced information. A question from Fiona. Cartrophen Vet for lumbar and shoulder OA. That comes a bit back to my knowledge of management of osteoarthritis. I guess my current understanding of drugs like Cartrophen is the evidence base for their benefit is quite low. We do suffer in veterinary medicine from low evidence base for a lot of what we do, and that's not because things don't work. It's just because we've not run the trials with sufficient numbers of dogs or cats in order to get the answers. Do you ever recommend complementary therapies for osteoarthritis? I personally, I feel that most chronic diseases require a multimodal approach. There's not, again, one magic bullet that's going to fix them all. Whether some of the complementary therapies really do impact on the outcome, I think most of them have not undergone rigorous scientific trials, so it's really hard to know. I think what they do often is help focus everyone's mind on the problem and then help the holistic approach to the problem. So let's take your example of Reiki. I think that also helps that all the other things are done well, and the net effect for the patient is beneficial. I think where we need to be a little bit careful is that there are some alternative complementary therapies which are potentially dangerous, and there we do need to be careful. So if Reiki doesn't work, then it's highly unlikely to be doing any damage, and your Doberman's probably going to get a really nice massage, which is great. But some of the things like chiropractic, particularly in small dogs, has the potential, if it's done with somebody who doesn't really understand what they're doing, to really cause damage. So we do need to be careful about some complementary therapies to really understand what risks and what benefits they should bring. And a good practitioner of any complementary therapy should be very willing to discuss with you the evidence they have for what they do, the risks and the benefits of what they're trying to deliver for you. Right. Okay. I think we could probably go on here till midnight, but I absolutely sure everyone has places to go and things to do. So thank you very much.
Thank you.
I'll sign off now.
Thank you everybody for joining us. I'm so sorry about the technological problems.